Can you hear that? This is the sound of a child with chronic persistent wet cough. Scary, isn't it? Whānau, this is a serious warning sign and should not be ignored. Your child needs urgent medical attention. What is chronic persistent wet cough?
A chronic persistent wet cough is a mucousy, phlegmy, fruity sounding cough. It sounds like the children have got mucus down in their chest, and it usually occurs most days and can go on for weeks at a time.
Here is an example. This cough is not normal and may be a sign that your child has a serious chest infection. It is important that your child sees a doctor as they could develop a serious lung disease. What happens if chronic persistent wet cough is not treated?
If a chronic persistent wet cough is not treated, it can go on for weeks and even months, and it is a sign that there's an ongoing chest infection in the lungs, and it essentially is causing some permanent scarring in the lungs.
Chronic persistent wet cough, if left untreated, can lead to lung damage and disease such as bronchiectasis. What is bronchiectasis? Bronchiectasis is a chest disease in which the breathing tubes, called bronchi, in the lungs become damaged and enlarged. Tiny hairs, called cilia, line the inside of these breathing tubes. These hairs help to clear any phlegm or mucus from the lungs. When your child has bronchiectasis, their lungs make more mucus than normal. The tiny hairs that should clear the mucus stop working properly, and the mucus gets stuck in the breathing tubes. It is within this extra mucus that germs grow and cause infection. These infections cause damage and scarring to the breathing tubes and lungs. The breathing tubes become baggy and holes form in the lungs. Once this has happened, the scarring and damage cannot be fixed. What causes bronchiectasis?
Bronchiectasis is a type of permanent lung scarring which is caused by having ongoing infection in your lungs. That mucus means that there's mucus and bugs down there, and it's breaking up some of the lung walls and doing lung damage.
What are the symptoms of bronchiectasis? Children with bronchiectasis will feel well most of the time, but the main symptom to look out for is the chronic persistent wet cough. This cough produces a buildup of phlegm which may be yellow or green in colour and smelly, showing signs of infection. It is important that you seek medical attention if your child has these symptoms. What happens if we ignore this symptom?
Ignoring the chronic persistent wet cough means that you're going to go on and develop more and more lung scarring. That cough shows that there is problems in the lung. It shows that there is a build-up of mucus, that there is infection, and the more and longer that goes on, the more damage that lung is going to have permanently, lifelong, and set the child up for recurrent further infections.
How can bronchiectasis be prevented? By not smoking during pregnancy. Breastfeeding our tamariki. Early detection and treatment of chest infections in childhood. Improving living conditions. Eating a healthy, balanced diet. And immunisation. We visit the hiko whānau, who deal daily with the effects of having tamariki with bronchiectasis.
The illness has changed our lives immensely. I have to give up everything pretty much to go back and forth to the hospital when the girls are sick. They're sick at the moment, but they don't look it. But I know that they're sick.
How can a parent manage bronchiectasis? What can they do?
Some easy ways that parents can help to manage their tamariki's bronchiectasis are to get them more active, exercising outside, running around, on the trampoline, anything that makes them huff and puff. Because when you're huffing and puffing, you're getting air circulating all the way down to the bottom of your lungs, and that helps to shift the mucus. Other things that are really good to help with managing bronchiectasis are to keep your whare au wahikore, So keeping your tamariki smoke-free and telling your whānau to keep outside of the whare when they're smoking and out of the waka when they're smoking.
If you are concerned about your child's health, please seek medical attention. For more information, please visit the Asthma Foundation website at asthmafoundation.org.nz.